To date, more than 800,000 people have died of COVID-19 in the U.S. alone. But the lives lost are not only the ones impacted. According to the American Academy of Pediatrics, over 120,000 children in the U.S. have lost at least one parent to COVID-19. And over 22,000 have been lost to a caregiver or grandparent. This is significant given that over 4.5 million children rely on grandparents as guardians or providers of their housing. As unsettling as those numbers are, they do not even account for the summer surge of COVID deaths linked to the Delta variant. Not unlike the vast majority of COVID-related issues, the number of children losing parents or caregivers to the virus are disproportionately Black. For every white child who becomes orphaned due to COVID-19, 2.4 Black children have suffered the same fate. As the holidays approach, these numbers hit especially hard. Joining us to discuss the psychological impact that this may have on children is psychologist Dr. Jeffrey Gardia. Dr. Gardia, the numbers are just heartbreaking. The fact that they're so disproportionately Black children is heartbreaking. How do you kind of put this into some sort of context?
Well, it's very difficult to do that. I mean, certainly, as you know, African Americans have been disproportionately affected. Brown people have been disproportionately affected. Indigenous people. So we find that the collateral damage from all of these deaths of adults from COVID, now we see, and this is what's really ironic, isn't it, Charles? That the children have done very well with the virus. They're the ones who are least likely to get sick physically, but they're the ones who are having the biggest losses when they're losing parents. And as you were very correct in saying, also losing grandparents, in that many of our children of color are raised by grandparents who are much more, and those grandparents are much more at risk for COVID. So we see that the toll that this is taking on all children, but especially children of color, brown children, indigenous children, that toll is much, much worse, and something that we haven't talked about much. So I'm glad you're doing this story.
What toll specifically do you think will show up, manifest over this holiday, going back into school for these children and these families and these communities?
Well, that's a great question. We already know that children have been disproportionately affected with regard to anxiety and depression, just because they were separated from school for so long, didn't get services that they needed, weren't learning interpersonal skills as they often learn in school. And of course, they didn't have the internet, they didn't have the devices as other children did. So we already saw a huge learning gap for our children of color. Now, when we're looking at the deaths of their parents and their grandparents, we know that these kids are having acute stress disorder, PTSD, post-traumatic stress disorder. So now, not only are the holidays difficult for them with regard to the holiday blues that we see so many people have, especially if they don't have financial means, but now these are children who are faced with not seeing their parents or grandparents during the holiday season, which is already tough for people to begin with, and it's going to be even tougher for these children. So really, they are getting the double whammy here, if you will.
You know, some people might say that every community is a village. I think Black people often think of their communities as villages. And so it's not just the children who are directly impacted, meaning that they directly lost a parent or a grandparent, but those parents, grandparents teach the Sunday school, they help the children, onto the bookmobile, or they volunteer for the Little League. What is the impact on the whole community of the loss of the parent figure, the grandparent figure, for all of the children, not even if they're not related to them?
Well, as we talked about earlier, we know that many of our children of color, their grandparents are very much in their lives. The elders are in their lives. And so when their parents, when these kids' parents are not around and the grandparents step into the breach, now that's gone. The parents are gone. The grandparents are now gone perhaps from COVID. So now we have really, a loss that is unimaginable. They don't have the direction they need. They don't learn the love of their race and of their culture, which is what they learned from their grandparents. But then we also have to look at the financial toll, Charles. Now these kids may have to be on the streets because their grandparents are no longer around. They may have to go into foster care, and foster care is already overtaxed as it is. And then, of course, there are the issues of having to relocate to other schools, other families. So emotionally, this is so traumatic. We talk about adverse childhood experiences. Certainly COVID and the death of their caregivers is an adverse childhood experience that we've never experienced in the way that we're seeing it now.
How should the suffering of these children impact Black people in particular and vaccine hesitancy? I've just been trying to figure out what story, what fact would move the needle on this. Do you think that this suffering of these children will help to move that needle?
Well, one of the things we know as more people have gotten sick, more people have now have the inducement to actually get the vaccine even after getting COVID. I think once you get more of these stories out there as to the responsibility that people of color have to their children who are already at risk because they're treated as second and third class citizens in this country due to systemic racism, perhaps this will be more of an impetus to be able to sidestep that lack of trust they have for the medical system and roll up their sleeves and do what they have to do to protect their lives and that of their children.
Right. Dr. Jeff Gardia, thank you so much for joining us tonight. Now to New York City, where the mayor says the city is about to experience a significant surge in positive COVID cases. Omicron has become the dominant strand in the city and across the state. BNC's Dre Clark has more.
6 million people living in New York City have received at least one dose of the COVID vaccine. That's one reason why hospitalizations haven't gone up in recent days, as the Omicron variant bears down on the city.
Omicron is a real challenge. It's going to be a very challenging few weeks.
New York City Mayor Bill de Blasio says the number of positive COVID cases will surge significantly.
So far, thank God, based on everything we've seen so far, the cases are more mild than what we've experienced previously.
Last Friday, New York State reported more than 21,000 people had tested positive. It was the highest single-day total for new cases since vaccination started a year ago. Almost half of the positive new cases were in New York City. The alarming spike leading to long lines and wait times at COVID-19 testing sites around the city, and people demanding to know why the city seemed to be caught off guard.
My colleagues and I would all say, if this sudden surge caught us by surprise in terms of sheer ferocity, then that's on us to quickly rebound, make the adjustments, get the personnel where they need to be.
The COVID spike also bringing the curtain down temporarily on some of Broadway's most popular shows after cast and crew members tested positive. And the legendary Rockettes decided to cancel the remainder of their season. Meanwhile, in Harlem, Sam Roberts wears his message to the masses around his neck.
Stop playing games, folks. Be real. You want to stay here? Make that a real deal. Get your shots.
The city's health commissioner amplifying Roberts' message that getting vaccinated is your best defense.
It's never too late to get vaccinated. Regular testing is particularly important for those who aren't yet fully vaccinated.
I'm Dre Clark for Prime with Charles Blow.